For this assignment, I was assigned ketamine and PCP and other dissociative anesthetics. What I found out about ketamine is it's a legally manufactured drug for medicine for humans and animals, commonly known as a horse tranquilizer, but illicit supply is commonly diverted or stolen from legitimate sources like vet clinics or smuggled from Mexico. And then people often obtain them in like kind of a nightlife party setting amongst other people. PCP is produced in illicit labs and sold as pills, powder, liquid, or applied to plant material, which is like um, sometimes it's called wet cigarettes, where they dip a cigarette in PCP. Um, and that information is from the DEA. Other dissociatives like DXM are available in over-the-counter cough and cold products, and misuse involves high-dose syrup or gel caps or extracted powder, which of course is over-the-counter, so people are probably buying that themselves at stores. As far as social stratification, nationally, young adults ages 18 to 25 have the highest hallucinogen use rates. South Dakota also, it's 18 to 25-year-olds. I don't have, I couldn't find specific data about ketamine and PCP. It has hallucinogens altogether. Not all hallucinogens are dissociative anesthetics. A dissociative anesthetic makes you kind of feel out of body, disconnected from yourself, whereas just not all hallucinogens have that same effect. Ketamine is a Schedule III drug. It has short-acting dissociation, analgesia, meaning it helps to stop pain. It alters your perception. Some use it seeking euphoria and out-of-body effects. Misuses and dependencies are possible, of course, and known risks include acute hypertension, respiratory depression, especially if you're using it with other depressants, and lower urinary tract symptoms, which I thought the urinary tract symptoms was very interesting. I've just never heard that with ketamine. PCP is a Schedule II drug. It produces dissociation, hallucinations. It can cause agitation and nystagmus, which is like when your eyes like kind of go back and forth, or like kind of shake. It can cause hypertension, and it's addictive with a psychological dependence as well as you can have withdrawal symptoms if you stop. DXM is that over-the-counter dissociative that I talked about. High doses can cause dissociation and hallucinations, but also nausea, tachycardia, which is an increased heart rate, and the risks of this rise with other ingestants that you might be taking to also get high, which makes sense, all of it in your stomach mixed together. Long-term health impacts and life expectancies of people who abuse these substances. For ketamine, chronic heavy use is linked to ulcerative cystitis, which means your bladder getting ulcers in it or sores in your bladder, which obviously would cause bladder dysfunction. It can also cause cognitive psychiatric issues, and dependency can occur. The FDA warns on at-home compounded products and misuse risks. There's no real life expectancy decrement that I found. But a lot of times people who are using ketamine in this way are also using other substances, which then maybe those substances can decrease your life expectancy, and that could alter the statistics for ketamine use and decrease life expectancy. For PCP, long-term use is associated with memory and thinking impairments, as well as depression and anxiety and speech difficulties. Persistent psychological problems are often reported, and although I didn't find any life expectancy data specifically, there are risks that include like trauma and accidents while you're intoxicated that could decrease life expectancy. The WHO recognized ketamine as an essential medicine. Misuse exists, but historically it's a pretty low, like just per capita. So the WHO has not recommended international control beyond just what currently the scheduling, like Schedule 1, Schedule 2 drugs, due to medical necessity. So the medical value versus the misuse risk kind of balances out. Um, the PCP, like I said, is Schedule 2. Ketamine is Schedule 3. Um, and in South, that's federally. And then in South Dakota, it's the same. Ketamine is a Schedule 3, PCP is a Schedule 2. Kind of what I found is I didn't see anything specifically saying what PCP is in South Dakota law, but basically that South Dakota law, if it doesn't have it specifically said, then it defers to the federal scheduling for it. Okay, federally, if you're caught with these drugs, the first offense of possession federally is up to 1 year in prison and $1,000 fine, but those can increase if you have priors. And distribution trafficking penalties hinge on how much of it you have and, of course, what specific drug, because ketamine and PCP are in two different classes. South Dakota has certain circumstances that make the charges harsher, such as if you're selling it to a minor, if you're in a drug-free zone, um, and if you keep a place for like use or sale, that can actually really increase your sentence as well. So of course it's a lot harsher penalty for distribution than what it is for just possession. What I learned in my research is that ketamine doesn't have one area of the country that uses it more than others, but interestingly, PCP has more use happening in Washington, D.C., and then California, kind of in metropolitan areas, not as much in um, like smaller, rural areas. Interestingly, it seems like a lot of the data about PCP usage, though, is related to accident and trauma that happen while people are impaired with PCP. Um, and so I do have to wonder if maybe it is being used more in rural areas and maybe there just aren't as many um, accidents happening because it's just not as densely populated. As far as how that's affecting communities and different social problems or impacts caused by the drugs, the obviously the increased accidents that happen on PCP and the acute agitation and psychosis that it can cause can strain emergency departments and law enforcement agencies. Um, Drug markets obviously create crime because it's illegal, and that crime can create public safety issues. There's also strong correlation between people in custody for crimes reporting drug use, meaning that maybe drugs are increasing crime, which then would weigh down our justice system. So not just that it's illegal to do the drug, but that while they're on the illegal drug, they're also committing other crimes. I did find it interesting when I was researching this part that from 2017 to 2022, there was a 349% rise in illicit ketamine use. And I just thought that was interesting. I wonder what's I wonder if maybe a little bit of social acceptance of the drug contributes to that. Especially, there's a lot of talk about ketamine being used for depression and PTSD therapy, and that can kind of make people feel like, oh, maybe it's safer because it's used in therapy, and then they're more willing to use it as an illicit drug. That's just my theory. For that, maybe some social acceptance is increasing the use of it. Okay, thank you for watching.